Medicare is an amazing program that has literally saved the lives of millions of Americans since its founding. It has great coverage for those things that were originally covered back in the 1960s when it was invented, but as time has progressed, medicine has progressed and costs have progressed. But original Medicare has not really. And that leaves a lot of potential benefits on the table that could help seniors live better, healthier, and safer lives. So as it is the American way, private Medicare plans like Medicare Advantage plans have picked up where OG, original Medicare, has left off. So today, let's talk about some of the Medicare benefits you can only get when you have a Medicare Advantage plan. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them during the AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. So why is there a difference in benefits offered under original Medicare and Medicare Advantage plans? Well, really, fundamentally, at least in my opinion, it comes down to how they are designed. Original Medicare was designed back in the 60s by Congress and has been loosely managed by Congress ever since then. But this also means that it requires the congressperson from Kentucky to agree with the congressperson from California about what should or shouldn't be added to coverage and who should pay for it. But Medicare Advantage plans have a much freer hand to add benefits that they think will help keep people healthier and spur interest in their plans, regardless of what the honorable gentleman from Kentucky thinks about it. Thus, you can get some benefits that only Medicare Advantage plans have that you can't get on just original Medicare. First, and really the easiest to point out, is going to be dental and vision benefits. Now, I'm going to include them together because they usually come together on a Medicare Advantage plan. Usually they are designed in a number of ways, and the dental oftentimes can be full comprehensive coverage and can be an HMO or a PPO and is included automatically with many plans, at least here in Southern California. The coverage on these can go above and beyond many standalone dental plans because they are backed up and financed by a Medicare Advantage plan and are more of an additional benefit to the Medicare Advantage plan than a money-making endeavor like a standalone dental plan. So it doesn't have to balance premiums and benefits in the same way. On the other side of the coin, vision has much the same ethos, but they will usually have a set amount of money or allowance a year that can be used towards things like eye exams and glasses and contacts and a wide variety of lens types, bifocals, trifocals, and such. So why are these not in original Medicare? They would make more sense just to put them automatically in there. They had dental and vision back in the day. I don't know, it's a mystery to me, but I bet if you ask your dentist, they may have an opinion about it. Next up is a super popular benefit, which again, I think would never actually show up on original Medicare because of the number of conflicted interests that there would be, but is for free gym memberships. Now, almost universally, Medicare Advantage plans have free gym memberships as a part of their Medicare Advantage benefits, at least here in Southern California. And this could be directly with a gym or a third-party administrator that has deals with many of the big, small, and independent gyms that allow their Medicare Advantage plan members to go to if they're signed up. Those gym memberships have no cost and are almost always asked for by our clients. But the thing is, when I ask about them with some of our Medicare plan executives about what is the actual usage, it's less than 10% of the people who actually use them. So this is another example of folks loving the idea of a benefit, including myself, with a running gym membership, enrolling to a plan with a stipulation that has a free gym membership coverage, but then, never using it, but still won't be found on original Medicare. The next benefit is really the ultimate benefit that Medicare beneficiaries love. They love this benefit and would serve them extraordinarily well if it could be covered by Medicare, but would only sort of exacerbate the current financial state of Medicare, which is the Medicare Part B reimbursement. Now, what this is the Medicare Advantage plan paying a portion of their enrolled members' Medicare Part B premiums on their behalf. In 2025, the premium for anyone enrolled in a Medicare Part B is $185 per month. Now, this is no small chunk of change, but many Medicare Advantage plans increasingly are offering this reimbursement to pay $50, $100, $175 towards somebody's Part B premium on their behalf if they enroll in those Medicare Advantage plans, which obviously has the knock-on effect of freeing up close to $2,000 a year in a Medicare Beneficiaries budget, which, needless to say, is a nice bit of cash that can be used to help cover the other ever-increasing costs of living, so food, rent, and inflation. Another Medicare benefit that will only really be found on Medicare Advantage plans is coverage for things like acupuncture and chiropractic care. Now, this is a benefit that is super common on Medicare Advantage plans. They will usually have a specific network of acupuncture and chiropractic providers that can be utilized, a copay, and a specific set limit or number of visits that someone can use those services per year. It generally isn't unlimited, so there is normally a number, but it is available, and we have tons of clients who really benefit significantly from either of these types of care. Now, why was it not originally on original Medicare? A mystery to me, but I imagine possibly that perhaps chiropractic care and acupuncture way back in the 60s wasn't even a thing. I'd love to know for folks who were around there at that time, did that exist? The last benefit that one would only find on a Medicare Advantage plan, and really specifically only one plan, is an allotted budget and reimbursement for weight loss. Now, this is available on the SCAN plan, which is specifically designed but not limited to the healthcare needs of women, but it has a small yearly budget that can be used towards weight loss treatment. But I think realistically, this benefit will probably eventually go away as a much more practical solution, and billable solution for that matter, is the use of some diabetic management drugs like Wegovy, Ozempic, and Mounjaro, which are definitely just for the management of diabetic care and not for weight loss. Wink, wink. Either way, overall, Medicare Advantage as a private health plan has a much freer hand in designing their Medicare plan benefits than original Medicare did or does or probably ever will. Furthermore, not to mention all the Medicare Advantage plans do also cover everything that is also covered by original Medicare. That is part of the requirement to be a Medicare Advantage plan. So yes, they do have some great benefits, but there are still many other considerations to figuring out if original Medicare, a Medicare Advantage plan, or even a Medicare supplement plan is the right plan for your Medicare options. So please don't take these benefits as the deciding factor, because they really are more of a nicety if all the other really truly important things, that is doctors, medications, costs, and coverage, are covered first. All right, so with that said, I hope you enjoyed this video and really all of our videos. And if you or somebody you know has questions about their Medicare plans, please feel free to reach out to us at the information down below, and either myself or somebody from my team will be happy to assist them in person or over the phone at one of our many offices across Southern California in English or Espanol. So, for Michael's Medicare, I of course am Michael, hoping that you have a great rest of your day, and goodbye.